Stem cells are best defined as cells that have the capacity to both differentiate and multiply into 100 cell types that form a human being. They also have the ability to renew themselves continually and replenish lost cells throughout its lifetime. In total, the human body is composed of an estimated 30 trillion cells, making stem cells extremely important to human development. Consequently, stem cell therapy has become a very promising and advanced scientific research topic. The development of treatment methods has evoked great expectations, bringing hope to many individuals worldwide. Today, we will be identifying a recent advancement on the potential of stem cell research and its potential use in an area of neuroscience, specifically Parkinson's disease. Parkinson's disease is a progressive disease of the nervous system, primarily due to the degeneration of dopamine-releasing neurons in the substantia nigra. Dopamine is a chemical that acts as a messenger between brain cells and is vital for the smooth control of muscles and movement. Without it, many issues can develop within the human body. These issues vary from person to person, with early signs varying from mild to unnoticed, but worsen as the disease progresses. Popular symptoms often show face as a tremor, shaking, which usually begins in the limbs, hands, or fingers, bradykinesia, rigid muscles, impaired posture and balance, loss of automatic movements, and, but not limited to, speech changes. Symptoms can be treated with pharmacological therapies based on the principle of dopamine replacement. Current therapeutic options available are levodopa, DA agonists, enzyme inhibitors, and deep brain stimulation in the thalamus, subthalamic nucleus, and globus pallidus. These options are all extremely valuable, but are limited by two main drawbacks: troubling side effects, and loss of efficacy with disease progression. Parkinson's remains one of the most prevalent neurodegenerative conditions worldwide, with nearly 70,000 Australians currently living with the disease and 6.1 million individuals living with the disease globally, costing an estimated economic loss at just over 10 billion in Australia and 120 billion worldwide. Costs include medication, hospital treatment, alteration to the home, assistances, and house bills. With the help of stem cell therapy, economic and personal difficulties can be alleviated. The aim of stem cell therapy for Parkinson's disease is to restore striatal dopamine release. So consequently, clinical trials are aimed to reconstruct the nigrostriatal neuronal pathway, a bilateral dopaminergic pathway in the brain that connects the substantia nigra in the midbrain with the dorsal striatum in the forebrain. In one particular clinical trial, this is conducted by intrastriatal transplantation of human embryonic mesencephalic tissue, which are rich in postmitotic dopaminergic neuroblasts. The first phase of the clinical transplantation research aimed at finding answers for some unknown questions listed below. Results from 300 to 400 PD patients grafted with the neuron provided proof that cell replacement can successfully work in the human PD brain. These results showed 6 to 9 week old human embryos could survive transplantation into the brain, with PET detection of an increased F-dopa uptake and histopathological studies showing long-term, extensive synaptic reinnervation in the patient's striatum. Clinical benefits linked with the stem cell survival were reported from open-label trials in well-characterized and carefully monitored PD patients. With the trial now entering the second phase, its main focus is to develop this approach into a clinically useful treatment. However, with every great advancement comes drawbacks. The most problematic complications include the lack of standardization of cell material, which contributes to the high variability in the degree of symptomatic relief and our inability to perform large-scale clinical transplantation trials due to the ethical issues with the lack of available donor tissues. So what's the point of doing further research and funding if this is the case?
While successful transplantation of the tissue can, however, assist people living with Parkinson's to achieve a better quality of life, while simultaneously reducing the cost of this condition to the community. It also provides practical strategies for reducing direct healthcare costs by avoiding unnecessary hospital and aged care admissions and decreasing lengths of stay and medical specialist consultations.